Thank you very much, my brother, Honorable Felix Ofosu-Kwakye. I've seen my Deputy Minister responsible for health, the Chief Director of the Ministry, the CEO of Ghana National Health Insurance Authority. I've seen the directors from the ministry. Ladies and gentlemen, I am excited to take this opportunity through this medium to account to the people of this country the happenings in the health sector vis-a-vis the 2026 budget. The 2026 budget is the most people-focused and health-centered budget I have seen recent years. And it aligns so well with the resetting agenda. And we all know we cannot have a productive country without paying attention to the health sector. It is well known that the health of the people in every nation is the wealth of the nation. So you cannot have a prosperous nation without a very strong health sector. And it is His Excellency the President's belief that provision of quality health care is a matter of right and not a privilege. We also know that across the globe, every dollar you invest in the health sector, you are likely to get 2 or 3 folds of economic returns. And therefore, we all know that the health sector is critical, and we see the expenditure not as a cost, but as investment. To begin with, this year, the 2026 budget has seen some 34 billion Ghana cedi allocation. 34 billion Ghana cedis. And that is obviously about 9.4% in increase in the 2023 budget. And then it also represents more than 11% of the total expenditure in 2026. Out of these amounts, we have the National Health Insurance Scheme that takes around 11 billion. And as I indicated the last time, we are voted into power to solve problems. And so we inherited some challenges with respect to the National Health Insurance Scheme. If you all recall, the National Health Insurance was capped, and it was bedeviled with delay in the payment of claims, unrealistic payment of tariffs, and a lot more, co-payment. And so since we took office, His Excellency, one of the policy directives he gave was to uncap the National Health Insurance, so it still remains uncapped. And there is now prompt releases of funds to the National Health Insurance Fund. Gone were the days where you hear service providers shouting on top of their voices on the rooftop that they were going to withdraw services because they were not receiving payment. And this is no more the case as I speak to you now. In some cases, my CEO will have to call even some of the service providers to bring their claims for payment. That is the current status of the National Health Insurance Authority. And so it is not by coincidence that there is a lot of confidence in the National Health Insurance Scheme. The coverage was around 18 million people as at the time we took office, and I can confidently report that in a matter of less than 1 year, we are around 20 million people, which represent about 60% coverage. And beginning next year, we are going to increase the tariffs in the National Health Insurance to the service providers, because it is something that the service providers have been complaining about, that the tariffs we give them are unrealistic. And so government has taken the decision to increase the tariffs about 120% on average. And I believe this is going to be a game changer. Again, we all know that primary healthcare accounts to about 80% of our health needs, especially in this country. And so when we have our primary health care right, I think that we'll have a very strong health sector. So His Excellency the President has directed that beginning next year, we have to roll out what we call free primary health care. And we'll be looking, in addition to the curative, we'll be looking at enhanced promotive health care, we'll be looking at enhanced preventive health care, and that will give rise to the early detection of the diseases, not even get to the complication stage. And some 1.5 billion Ghana cedis has been allocated for the free primary health care. And let me be quick to add that this will still fall under the National Health Insurance Scheme. We are not going to reinvent the wheel, and so it will fall directly under the National Health Insurance Scheme. We are in to solve problems. Again, about 4 out of every death we record in this country is due to non-communicable diseases. About 4,000 people are diagnosed of cancers every year. 1 out of every 3 adults we see in the street is hypertensive. Diabetes is rising. And so His Excellency promised the good people of this country to have solution to this problem. Hence the establishment of Ghana Medical Trust Fund, popularly known as Mahama Cares. I am happy to report that the status of Mahama Care is that, 1, the bill has been passed into an act, the board has been inaugurated, the secretariat is in full operation. And therefore, they've started disbursement for patients' care at the moment. Maybe before we end this session, I'll put out their telephone numbers so that if you want to have access to them, you can do so. And it's a very simple procedure you may have to go through. Your specialist medical doctor may have to apply on your behalf. And once it gets to the secretariat, within 14 days, they must respond to your application. And so Mahama Cares has also been allocated an amount of about 2.3 billion. So they are not worse, there are no more promises. These policies are seeing figures allocated to them, and it is not ordinary figures, as we have already demonstrated in the in the case of the National Health Insurance Scheme. We will do prompt releases. In fact, let me put it on record that since the establishment or inception of the National Health Insurance Scheme, no government has been able to pay promptly like we are doing today. No government. No government. Again, infrastructure. We now have 16 regions. And so 6 out of the 16 regions have lived for the past 7 years without any regional hospital. His Excellency promised the good people of this country that he was going to construct 6 regional hospitals in the regions where there are none. Fortunately enough, in 2026 budget, we are going to begin the construction of 3 regional hospitals, namely the Savannah region, the OT region, and the Western North region. And some 600 million Ghana cedis has been allocated to that effect. So when I say this budget is health-centered, I mean it, and I know exactly what I'm talking about. In as much as we are constructing new district hospitals and new regional hospitals, His Excellency the President has again directed that no uncompleted health facility will be abandoned. We will continue to pursue La General Hospital, Confanoche Maternity Block, Sewia Regional Hospital, Agenda 111, and all other CHIPS compounds. Don't forget that every district is supposed to construct not less than 2 CHIPS every year, and that would add up to our numbers. Retooling. A health center is not just the building, the personnel, the building, and of course the tools, the equipment. Our status of medical equipment in our health facilities is very dire. The situation is very dire. The last time we did a major retooling in this country was His Excellency John Dramani Mahama I administration, the first administration. Since then, our health facilities have been suffering. We have reports that indicate that more than 50% of our CHIPS compound do not have basic equipment, basic ones. And therefore, as part of the free primary health care, we are going to retool our primary health facilities to have the basic equipment to be able to deliver, to give real meaning to free primary health care. We are not only going to do that, we are seeking to establish 3 catheterization centers, namely the Kolebu Teaching Hospital, the Komfanoche Teaching Hospital, and the Tamale Teaching Hospital. We are buying DNA testing machine. The last time I said that, I saw a lot of infographics about me and suggesting that I was going to insist on compulsory paternity tests. I'm sorry, that was not coming from me. So you must disregard that. And so we are going to buy DNA testing machine for Noguchi Memorial Institute, and Mahama Cares will also be seeking to retool some of our teaching hospitals and then the regional hospital to be able to treat the non-communicable disease. In all this, we have brought the private sector in because government cannot do it all alone, where we'll be looking at the private sector bringing their equipment to the health facilities, and they will be paid. When they put up their claims, they will be paid either by the National Health Insurance Scheme or by Mahama Cares. Now we have more than one health financing scheme. And so that is what we are doing. With respect to the workforce development, out of the 34 billion Ghana cedis, some 16.7 billion has been allocated as compensation. And so we'll continue to pay the 13,500 nurses we put on the payroll this year alone. We are distributing not less than 700 medical doctors across the length and breadth of this country. And His Excellency the President has directed that we send these medical doctors to where they are needed most, especially the districts. I'm sorry to say that we have more than almost 50% of the medical doctors we have in this country in the Greater Accra. And therefore, let me take this opportunity to appeal to the medical officers we are posting here at the moment, not to see this policy as punishment, but as an attempt for equitable distribution of the workforce we have in this country. And of course, government will also be seeking to create that congenial atmosphere for you to deliver your work. That notwithstanding, we have paid some 500 million Ghana cedis for the nursing trainee allowance. And first week in December, we are going to pay 231 million Ghana cedis again. So we are not piling up arrears. We are paying promptly the nursing trainee allowances. At this point, let me use the opportunity to clarify the happenings in the Zipline, the drone services. A contract was signed in 2018. It took effect in 2019. And as part of the contract, there were clauses known as take or pay clauses in the agreement. And the contract was so sourced. Now, for every month, Ghana government was and is supposed to pay $88,000 per center per month. $88,000 per center per month. So if you do the computation, we are paying more than, because we have 6 centers, so we are paying a little over $500,000 every month for the services of the drones. What is more interesting, and I think everybody needs to know, is the fact that in the beginning of this contract, the idea was that we were not going to use government of Ghana money to pay the services of the drones. And I have the Hansards here during the debate on the floor of the House. And the quotation from the then minister responsible for Health, Ajimamanu, I have it here. I think that the question was asked about why the signature of the minister responsible for finance then was missing in the contract. And he had this to say, among other things. Mr. Speaker, I would want to stress again that the Honorable Minister for Finance did not put his signature on, because this is not going to be done from the consolidated account. The public purse is not going to come in here, unquote. And the whole discussion has to do with the fact that they were not going to pay from the government of Ghana fund. And some other stakeholders were engaged, and I've had the opportunity to verify from them, including the GMA then. And same argument was advanced. Apart from saying this on the floor of the House, government of Ghana has paid a lot of money to the Zipline. Apart from that, their services was to concentrate on the hard-to-reach areas and emergency services. But upon review of the activities, what we have realized is that the hard-to-reach areas constitute only 12% of the activities, 12%, 1-2. And emergency services is 4% of the activities. And it will interest you to know some of the items they fly. Items like condom, blood donor cards, not blood, blood donor cards, mosquito nets, food and nutrition items, adhesive tapes, syringes and needles, education materials, among other things, textbooks, exercise books, uniforms, and a lot more. So these are some of the items they have been flying. And so when we came to office, we think that there must be value for money. And therefore, we are engaging them. So if you hear that we are not engaging Zipline, it's not true. We have met more than 3 times, and we are still engaging them to know how we can have value for money. And that is what His Excellency the President has directed us to do. That in our respective ministries, we must make sure that whatever we are doing, we have value for money. I think at this point, I want to pause here for your questions. I thank you for